welcome back to my channel. Everybody's been asking me to do more videos of what you need to know for each block, so I decided to do the internal medicine video because I just finished internal medicine and I've been extremely busy lately, and I have been working on other videos, but I thought that I would pause, take a moment and just get this video over with so that it may help you, it may help other interns. I want to start off this video by talking about the diseases that you need to know for internal medicine. Okay, so from the top of my head, the diseases that you're going to encounter, if I could just quickly break it down, you're going to have your acute, your chronic, and then your emergencies and malignancies. So for your emergencies, there were very common things that we saw in internal medicine. That was DKA, status epilepticus, an asthma exacerbation, the hypertensive emergencies and urgencies. I would also classify parasuicide as an emergency because we saw so much of parasuicide. And keep in mind, guys, that in internal medicine, you're treating patients for a very long time, most of the patients, because in internal medicine there are a lot of chronic patients, decompensated heart failure and compensated heart failure. You have your diabetic patients, your patients with hypertension, you have your malignancies like your lymphomas, your hepatocellular carcinomas, your gastric cancers. Lung cancers are so common. Well, in my setting, lung cancer was quite common. You have your acute patients that come in DKA or meningitis, or there's even instances that they may come in seizures. Another important emergency that you need to know is status epilepticus, patients with pneumonia, lower respiratory tract infections, because we were in the COVID time. We also had COVID patients. You might get lucky and maybe no COVID. There are patients that had GBS, the acute kidney injury, the chronic kidney disease, the patients with end-stage renal disease. So we've seen a lot of that. It's a lot of chronic patients, and treatment is ongoing. It's for a long time that you're going to be seeing these patients. Another common disease that we were treating in clinic and seeing patients in an ongoing period was people with mitral valve disease. These patients need to be on long-term warfarin, so you're checking their INR monthly and making adjustments to their doses or admitting them if they have warfarin toxicity. So please do read up. Reading is so important. Get familiar with the cases that you're gonna see, and read over some internal medicine cases and go over your physiology. It's going to be extremely helpful for you to understand the disease pattern and also how we treat it and how you approach each disease. To compare internal medicine with another department that I've done, I know it's not so great to just compare just between two because I've only done obs and gynae, but there is a huge difference between obs and gynae and internal. Of course, internal medicine is a slightly more laid back and relaxed compared to obs and gynae. Obs and gynae was extremely busy. You were also in theater a lot. So with internal medicine, you do a lot of bedside procedures. There were many procedures that I did, like lumbar punctures or insertion of CVPs, and I mainly did the subclavian CVP, not the femoral. And you take a lot of bloods. You take a lot of bloods, guys. You're gonna be walking around all the time because you need to monitor these people's progress with their treatment and how things are going. Like, for example, if people are coming in with acute kidney injury or end-stage renal disease and the urea and creatinine is very high and you got them on dialysis or you got them on fluids, and you need to monitor that and obviously check if their urea and creat is going down or if it's going up. And most of these patients, you're also working them up for a renal or cardiac proforma that you send to another higher institution. So there's a lot of tests that you need to do on them. There's daily bloods, there's ECGs, there's x-rays, which you of course just request, but you do a lot of work in internal medicine, and there's a lot of paperwork, and your day can become busy because internal medicine is packed with patients. Well, I noticed in this facility that I was, it was quite busy, and there were patients even in other wards, so you were constantly moving back and running around. So your comfort is important as well. I did mention this in my other video. Your shoes are important. How you dress up is quite important, but I was actually dressing up more casually in internal medicine. I used to just wear my scrubs for call. So for your calls, you basically, in my facility, we worked a whole day. We worked from 7:30 to around 4, and there was no break in between. Our call begins at 4 p.m. Whereas in my obs and gynae block, we worked from 7:30 to 4 p.m. and then our call began at 6 p.m. So there was that 2-hour gap that you could just go back, recompose yourself, get whatever you need to. But in internal, we started immediately, and how the call basically went was, you covered your ward, you covered your patients of your team if it was a weekend call, and you cover all the patients in all the wards for internal medicine, and you do the admissions that come through. So if patients are arriving in emergency and they are for internal medicine, you will be notified. The emergency doctors do that. They'll send, if the patient is for ortho, the patient goes to ortho. If the patient's for internal, they call us, or they called us. And how it basically was, we went there to emergency. Remember that these patients are usually stabilized before we get there, but we do obviously prescribe new drugs, do more tests, and as an internist would do. Yes, so you would do the admissions, you would get time to sleep, depends on how the doctors divided the call, but sometimes you would not get to sleep. But I found that I did get ample amount of sleep during my calls compared to obs and gynae, where I hardly even got sleep. So yes, your calls in the facility that I was, the room was not very comfortable, and the windows were kind of hard to close, so it was very cold, and the mosquitoes were always coming in. So I used to sleep in my car. Have yourself prepared for your call if your facility is like that. I used to carry a blanket, all my food, whatever I needed, a pillow, and I would just sleep in my car and go from my car to the wards when they needed me. Every hospital, every department have their guidelines that they follow and use for diseases and how they approach different diseases. So we used to use the Ngulazan protocol, and obviously your department in your facility will have their own for their hospital. But you can also use the EDL and the EML app. It has everything in there that you will need. I'm sorry about the noise. And there is another app called Amboss, but I think you need a student ID for that. So if you are a student in the medical universities, you will have your student number, and you probably can use Amboss, and it's going to help you a lot. Okay, so your paperwork. Internal medicine, like all departments, does have a lot of paperwork. However, internal medicine, I feel, has a bit more, and even pediatrics. So let's start off with your discharge. So I'm going to show you that. So some hospitals which are more modern, you may have computers to type your discharge summaries out and print it and blah blah blah, but our facility had papers. So you'd probably make like 3 or 4 copies with a carbon paper and do that in handwriting. So your discharge summaries are important, how you fill them out, what you did for the patients, what was their outcome, did they improve, what would be their follow-up from now, when is their next date, and yes. So your next one is your request for consultation. So you would usually fill out this form when you need to request consultation from either another department like surgery or ortho or psychiatry, or even for the dietitian or the social worker. So you fill out this request for consult for that. Then you have your results sheet, and obviously you'll be using an app on your phone which is called LabTrack for the NHS, and you will get your blood results on there, and then you fill it out here with the date and what was the result for those bloods on each patient after you do get the results. The next thing is actually 2 combined papers together, and this is for blood transfusion. So you got your first paper with the details and what you want to order. It looks like this, and then you got this orange card where you fill out the patient's details, and when they do issue something, they'll put a sticker there with the details. Now guys, I must stress the importance of this needs to be filled, and there cannot be any mistakes on these papers. You cannot scratch, you cannot write the surname before the name. you cannot write incorrect details anyway, because they will reject this, and then your patient won't get transfused, and then it will be your headache. So when you do order for transfusion, there is another tube, a transfusion tube that you put your blood into, and then you send these papers. Okay, the next is, I'm just going in any order, a fluid balance chart, where they monitor the input output and where you are ordering how much and what type of fluids you want to give that patient. Okay, the next is a CT request form. This is how it looks. It's going to look the same probably in your facility as well. Not just anyone can order a CT. It needs to be signed and stamped by a consultant and approved. So you usually get that done, and then you fill in everything, and you need to also put down the urea and creatinine here. The next one is the blood request form, or actually any bodily fluid request form that you want to do a test on. So you can order your urine, MC and SCI, your CSF analysis if you do a lumbar puncture, all your bloods, your chemistry, your virology, all is here. So I'm not sure if other modern facilities have a better way of doing it, but this is what we have. So you'll put one barcode onto the patient's file, and then you put another barcode onto the sample, and then you fold it up and you put it into a plastic, and then you send it off. And there are even cytology forms apart from these blood request forms. The next is the medication prescription. So actually it's not only for medication. Even if you do order fluids, some people do tend to write it down there. Or if you are doing a shift, so all your drugs go in there. You'll write the drug name, the dose, the route, and the date, and you'll sign and stamp there. Remember, all of these things need to be filled in. So the name, the age, the registration number of the patient, which ward they're in, if they have any allergies. This is extremely important, and you need to be thorough with your paperwork as well, guys. Okay, the next is a consent form. So this is a consent form. So any procedure that's invasive or may have side effects or may have complications, they need a consent form for that. So for example, if you're going to do a blood transfusion, you need to explain the procedure to the patient, and you need to get consent for that. You're going to explain what it is, what it's for, what are the complications, what are the side effects, what are the benefits, and then you sign there, and then witnesses sign here at the back, and then the patient signs there. The next is an X-ray ultrasound request form. This is what it looks like. So you'll write a brief history of what's going on with the patient and what you're requesting for and what you want to see, basically. So if you have a patient with a lower respiratory tract infection that's requiring oxygen, you just want to see what the lungs are looking like. So you'll write blah 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 blah, and then you're going to have your stamp and your signature there. Okay, and the next page is the history and progress notes. So you're going to be using this every day. This is where you write your daily notes and your continuation from the admission. So this as well needs to be filled in thoroughly. The patient's name, which ward they're in, which room, and their identity number, registration number in there. Now here you'll have your date, your time, your signature goes in here, and then you'll have all the details and the progress of today, and what you're changing, what you're doing, or if they need to be discharged, or if they need to remove an IV line, if they need a catheter, if they need to change their drugs. Everything needs to be put in. And as an intern, you're usually going to have to write discussed with and who you discussed that with. So for example, if you're gonna be working with a medical officer, you write there discussed with Dr. so-and-so, who is your medical officer and has guided you in the decision of what you want to do for this patient. Okay, this is also another product form from SANBS. We used to use this a lot for Albusol when we were doing acidic taps. This as well needs to be signed by a consultant, so you can fill in all the details and order your whatever you need, and then it will be signed by the consultant. So we used these forms, and we needed to fill these in for our cardiac patients and our kidney patients. So these are nephrology referral performers and cardiac performers that we needed to fill and get everything done so that we could refer them to institutions that could actually manage their case and make improvement for them if they were candidates for this. So there is a lot that goes into this, and working up all the investigations that you need for this patient. There are millions of things you need to do for the patient, and then you discuss it with a doctor of that hospital. For example, we needed to discuss with Nkosi Albert Lutuli. So once this was done and we had our patient ready, then we would refer, and then they would accept to continue management with the patient. So that was kind of all the paperwork you'd be seeing in internal medicine. However, I did not get the admission paper, so our department had a separate admission booklet that was quite helpful. It had everything there, so we didn't forget things to ask when we were admitting the patient. It was quite well structured and very organized, and it was very useful. So you do have your admission booklet as well, and I would suggest having a weekly schedule where you can put down the patient's name. And if you did watch my other video, I had a video of it there. So you put down the patient's name, what disease they have, and what you're doing each day, or what needs to be done the next day, or the next week, or so on. Okay guys, so familiarize yourself with making problem lists for the patient. So after you've reviewed the patient, you reviewed the bloods, you've done your exam on the patient tells you what's wrong with them, and you make that problem list. And from that, it's how you're going to do your plan. So probably you found that the patient is now having a UTI after having a catheter in for so and so days. You will now prescribe something for that, and obviously either remove the catheter and send the urine for urine MCNS, and work that way. And there's millions of things I could talk about, but I don't want to make this video too long. So just another quick tip, like I showed you, there's a lot of paperwork. So having a small thin envelope type of file with all of these paperwork, a few sheets each, would be so helpful for you. We had a file in internal medicine that had all of the paperwork so we weren't running back and forth. So having that with you, not just for internal medicine but for any department, is extremely useful. And I used to also carry in my moon bag. I showed you the moon bag in the other video, but just remember that internal medicine is extremely important, especially when you want to learn physiology and you want to understand your patients. Personally for me, I don't want to specialize in internal medicine because it's just not something for me, but I did enjoy the block and I did have a lot of fun there. It was quite relaxed. I got to learn a lot. I got to do a lot of procedures, and not as much as I wanted to, and not as much as I did in obs and gynae. However, I did learn a lot theoretically in internal medicine. But having that moon bag and having different tubes in there with the syringe and the needle and something else just to take bloods when you do need it is extremely helpful. You can carry it if you want to. If you're one that doesn't like to have a lot of things on you, then that's perfectly okay. But if you don't like running around, guys, then I would suggest just keep some on you in your little bag. And another thing I want to pick on and make sure you don't forget is when you're having patients in internal medicine for a long time and they've been there for weeks on end, you want to remember never to forget about requesting physiotherapy for these patients as early as possible, especially to avoid bed sores and avoid them losing memory of how to use their limbs, and their limbs becoming atrophied. They need to always be able to have physiotherapy. So don't forget about that. And you work as a multidisciplinary team with physio, with audio, with ophthalmology, because patients are not just going to have one problem. They're going to have millions of problems, especially the older patients and the patients with chronic diseases. So don't forget, when you are working on these patients, you don't just work on them alone. You're going to be seeing these patients with a whole team that you may need. And your attitude towards your co-workers is extremely important. You know, the nurses can make or break you. So I would suggest just try to maintain your cool, even when things get rough. Like, to share an experience that I had during a resus, I was the leader and I was asking for different things from different nurses, and most of them just stood aside while it was like a one-man team doing a resus, and you can't do a resus with just one person. So you might find this happens to you. It happens a lot in the government hospitals But yeah, during a recess, some of them may just sit there or stand there or walk away, or you'll find 100 of them running to look for a blood gas syringe. So try not to take it too hard, try not to be too erratic about it, and work yourself up. I know I used to work myself up and it never got me anywhere. So maintain your cool. There's only so much you can do, and be kind to them. Even when they're not kind to you and they give you hell, just try to be sweet, try to be kind. It's gonna make you a little less stressed out and make your work environment for yourself better, because I've just become so numb to all their bullshit and all of the politics in the hospital that I just do whatever I can do, and I work to the best of my ability and work as hard as I can, and I'm not going to worry about if they're not doing their work or not. So that's just my personal advice to you, and I hope that it helps, and I hope that you become a little less stressed out through your blocks, even when you have co-workers that are not on board with you. Just know that you need to be open to learning, and be able to ask for help. You know, put your pride aside and ask for help when you do need it, and learn, absorb as much as you can, because remember, these people that work with you, most of them know quite a lot and are very experienced. So you'll be becoming better as a doctor, and also learning a lot, which will be very useful in the future. So take it slow, absorb as much as you can, and read on your physiology. Okay guys, just read on that and go through your guidelines. So I hope that this video was helpful, and I hope that it helps you through your internal medicine block. So good luck guys.